to my channel. I am back. Life's been kind of crazy. I started the doctorate program, so I'm just adjusting to my new normal, APA and APA and APA. So writing lots of papers and whatnot, that used to be my weakness, but it has become my strength because I've written so many papers that I'm really getting good at it. And sometimes I look forward to it, which is weird, really weird, because that used to be the one thing that do we have to write a lot of papers? I remember when I was getting ready to go to NP school, I would ask, do we have to write a lot of papers? And if I heard yes, I was really thinking about not going because I did not want to write a lot of papers. And you guys know in the doctorate program, it is writing heavy. There is lots of writing. And if you're weak in that, then make it your strength. Work on it. Get the APA book and read it. Just master it. Because if you have one advantage, if you know what your weakness is, then you're able to work on it. So a lot of people walk around and they have no idea that they're weak in this area. They think they're great at it and they're really not, and somebody else has to tell them, like, you're really not great at that, you really need to work on it. So it's a blessing to know that you're weak in a certain area, because then you have the opportunity to make it better. So one is definitely not better than the other. It just depends on what you want. I really think that in life we have to stop comparing so much. Like, even just comparing ourselves to other people, that can make you feel depressed. Just be you, work with what you have, and do what you need to do to bring happiness into your life. When I think about my time as a bedside nurse, I loved it. I enjoyed it. What I miss about it, I'm gonna tell you guys what I miss about it, which is like actually being able to care for the patients. And what I mean by that, yes, I know as a nurse practitioner, I care for patients, but in a different way. As a bedside nurse, I miss pulling the covers up over my patients before they went to sleep. I miss going into their rooms when I did rounds and asking, hey, do you want a snack? And oh yeah, I would love one. Taking them graham crackers and milk, or just going in and saying, are you okay? Can I get you some fresh water and ice? Oh, I'd love that. And I go get it and they're smiling. Or when I go in the morning and I open the blinds for the first time, and I feel like a little ray of sunshine when I walk in the patient's room, especially when they're happy to see me. Like, I do miss those things. I miss that ability to actually care for the sick. So even though I'm caring for the sick now as a nurse practitioner, again, it's in a different way. As a nurse practitioner, I am seeing patients and I'm doing assessments and prescribing medication, but the way that I put my little twist on things and the way that I am able to give that caring, the way that I care for my bedside patients, when I did extra things for them, for my outpatient patients, I will call them if I am worried about them, or if I want to check on them. Like, I have some older patients, and sometimes I will call, like, I'm calling to check on you. Do you need anything? Refills on your medication? Is everything okay? So being able to touch base with my patients, I've had lots of patients express just, wow, I can't believe you called me just to check on me, or if I get a patient who was pretty sick and I just want to make sure that the treatment that I prescribed or the treatment that I recommended, I want to make sure that it's working and that the patient is feeling better, I'll call those patients to check on them. So I am still caring for patients, of course. As a nurse, that's what we do. We care for patients, but in a different way as a nurse practitioner. So being a registered nurse at the bedside, and not all registered nurses work at the bedside. I'm just referencing my own career. Being a nurse at the bedside, I miss a lot of things about that. The sun is going down, so the lighting's changing. I miss a lot of things about that, but I love being a nurse practitioner. I love it. I feel like I have more autonomy. I'm able to care for my patients as long as I'm following the guidelines the way that I see fit for them, because we have to individualize care. Like, it's not one size fits all for any illness. So, you know, I enjoy that. But it's funny because that was the one thing that scared me when I first became a nurse practitioner. I was afraid of the autonomy, to be completely honest. I mean, for like, 16 years? Yeah, I've been an NP. I've been an NP for like 4 years, and I worked as a nurse for like 15 or 16. So for all of those years, I received orders and I just carried them out. And when you make that transition from being a registered nurse to a nurse practitioner or an advanced practice nurse, then it starts with you and it ends with you. In a way, because sometimes you refer patients to specialists and whatnot, to orthopedics, or you have to refer them to cardiology or endocrinology or something like that. But for the most part, you see a patient and you're going to make recommendations on the next step. And that's completely different from what I was used to for a good 15 or 16 years. So when it comes to which is better, RN versus NP, there is no better. It's all about you. What will make you happy? So neither one is better, but it's just about questioning yourself and being honest with your own answers as far as what you see for yourself, what you really want to do, and why. The why is what really matters. And the why, I feel like when you have a strong why or a strong reason for doing what you are doing, you're able to overcome obstacles, you're able to fight, you're able to reach that goal no matter what, because your why is so strong. Your reason is so strong. And I experienced that with this program, with the Doctorate program. This video would be so long if I went into it, but I will do a video about that. But there is no better, there is one is not better than the other. It's all about you and what you want. I'm really happy with the decision that I made. I absolutely love and adore being a nurse practitioner. It's everything I thought it would be. There are some things that I didn't think about. Why don't I share those with you guys? So some of the things that I did not think about when it comes to being a nurse practitioner would be how, as a bedside nurse, I was able to go in, get my assignments, see my patients, and chart and go home, and I'm done pretty much until the next day or until the next time that I go back to work. But as a nurse practitioner, your job is never done. And it took me a few years to realize that. I thought, because I was always striving for, I want everything closed out. I just want to be done with my work when I get ready to go home, but you're never really done. Every time you go back to work, you probably have labs to review from the last time you were there, because you're always ordering labs or tests or something. So you always have labs to review. it seems like someone is always sending you a message about a patient. The patient wants this or that, or a referral, or he needs refills, or the medication didn't go through. So there are documents to review because you ordered an x-ray for someone's lumbosacral spine. There's always something. And for those of you who are used to just finishing, that could be a little, you might need to adjust to that. I have had to adjust to that, to always having something there, something that needs to be done. So I would say that's the one negative about being a nurse practitioner. But for the most part, nothing's perfect. Everything has positives and negatives. But there are definitely more positives than negatives, I would say that. And I'm really enjoying it. It's been 4 years almost now. Anyway, for those of you who are considering becoming a nurse practitioner, it's a great field. It's very rewarding, and you also get this instant gratification just from helping people. And for people who want to go into the nursing field, just make sure that your motives are right, and make sure that you're going into this field because you have the desire to serve the sick. That has to be there, because if it's not, then you just may hate what you're doing. And I know that in every profession, there are people who have gone into the profession, and then when they get the reality of it, they're just like, I don't want this. So with social media and with YouTube and with, all of these people telling their stories, and just with people being really honest and candid about their experiences in nursing, you guys are really getting, a reality check when it comes to nursing and what to expect. So if you like for me to do a video just about the reality of nursing and to just talk about some of my experiences, I can do that. But I better go because I have to write a paper. No, wait, I don't have to write a paper this week, but I do need to answer a discussion question. So I hope you guys enjoyed this video as much as I enjoyed making it. Follow me on my other social media platforms, which would be Instagram, Snapchat, Facebook, and Twitter. I'm really loving Twitter lately. Well, I haven't posted in a while, but yeah, I'm gonna get to that. Make sure to turn your notification bell on so that you don't miss any videos. A few of my subscribers have told me that they didn't even know that I released my last video because they didn't get any notification. So be sure to turn on notification for my videos if you don't want to miss any, because I do plan on uploading more often. So yeah, I am going to get out of here, and I will see you guys in the next one.